Yesterday it's partially finished the dosage forms, and we were with the parenteral dosage form, means other than the enteric system, means enteric means it is including the oral, sublingual and intrarectal and many other routes. So here the first sentence that starts is with the injection. Injection is a sterile solution or suspension of the drugs for parenteral administration. Parenteral, other than oral route, is known as parenteral. So some of the drugs are available are unstable in the liquid form. So what they are supplied as a powder for reconstitution with already some sterile distilled water is placed in that thing, particular thing, and they are used as injection. Injection means inside the body. So injections, the examples of injections are the gentamicin injection. It's a aminoglycoside. It is very effective against gram-negative bacteria is concerned, and one of the most effective drug against urinary tract infection, but one of the most potent nephrotoxic drug. So these are all given injection. Why gentamicin is not given as the oral preparation is, it is destroyed by the gastric hydrochloric acid, because these compounds are quaternary ammonium compounds. Anyway, we are going to deal all those things in chemotherapy class is concerned whenever your subject is coming. Okay, next one is the serum. Yesterday I have told, but serum is preparation of the blood serum containing antibodies or specific antigens, and it is indicated promptly after the suspected exposure to a toxicant. That's very important. Suspected exposure to a toxicant. So here, whenever the animal is suffering from the tetanus, which is caused by the Clostridium tetani organisms, there will be convulsions and other things will start. So the tetanus anti-tetanus serum is administered to the animal through the parenteral route. Then the disease is controlled, and the tetanus toxoids and also many other diseases, the anti-venoms or anti-serums, and especially the anti-snake venom is also a serum of the animals. Yeah, then it is the solids, the portion of the solids, and implant is a solid material inserted or grafted surgically into the intact body tissues. So it may include medicated bodies, tissue grafts, and artificial pacemakers. This is inserted inside the body, maybe sometimes subcutaneous or below the skin, and sometimes it is intradermal also, it is applied. So these are all the medicated substances. So the naloxone, implants of an naltrexone or naloxone. So whenever the patient, especially in the de-addicting center, this is very commonly used, because if a patient is having the addiction of the drug, then every day the antidote cannot be administered to him orally, or sometimes he may resist also. So the implant of this naltrexone or naloxone, it is administered in the human body as an implant. And apart from this one, diethylstilbestrol and anabolic steroids, which are the growth promoters. Some of the anabolic steroids are also used in the meat producing animals, especially the pigs, and also some food producing cattle, especially meant for slaughter, to have the weight. Of course, there are a lot of controversy whether to use the hormones or not, but here the form of the drug is used is implant. In pellet is a very small ovoid or spherical sterile mass of the drugs, usually of steroid in means etc. and meant for implantation in subcutaneous tissue by incision. So it's a repository or depot storage from providing the sustained release of the drugs over extended period of a time. So here implanted. Sri Kripa, please mute your mic. It serves as a repository or depot dosage form, providing the sustained release of the drugs over extended period of the time. That's known as the testosterone implants are very commonly used as the pellets. And the gases, coming to the gases, once again, yesterday I have told this may be a repetition, but aerosol is a suspension of the fine solid or liquid drug particles packed in a container under pressure in gaseous form. So drug is released upon activation in appropriate valve system in the form of the mist or fog. Here you can see that many type of the aerosols are present. One is the nasal aerosol. So your Vicks VapoRub inhalant is there. That is nasal aerosol, and lingual aerosols and inhalation aerosols. So the example of this thing is terbutaline is a bronchodilator. It is very commonly used as the aerosol of all the three forms, the sublingual and buccal preparations. All are available. Especially it is used in asthma of the patients. And here you can see that such type of the devices are used as the these dosage forms. And here you can see one nose should be, one nostril should be closed while the equipment should be inserted in another nostril and it has to be inhaled. That's how the nasal aerosols is taken place. The lingual aerosol of the nitroglycerin, especially nitroglycerin, is used whenever the patient is having cardiac attack. Very fastly the drug should act, and at the same time there is no time to give him the injections or anything. So immediately whenever he has got the angina pectoris, means pain in the chest, then the aerosol, lingual aerosol, is put under the tongue, and very fastly the nitroglycerin is absorbed into the circulation and causes the migraine to vanish. Yeah, inhalation aerosol, the ipratropium bromide, once again many times it's used in the as a bronchodilator. Then this is very commonly used as inhalation aerosol. Means here you can see that there is a plunger with the drug containing body, and whenever it's pressed, a known volume of the drug is being aerosoled or inhaled by the human being. Yes, of course, the nebulizer or nebulizer. So the delivery used to administer medication in the form of the mist or inhalation to the lungs. And the treatment of the asthma and other things are being taken by this particular type of the drug delivery system. And COPD means congestive obstructive pulmonary disease, especially in case of human beings, it's very common. And inhalant is the one volatile drugs which are carried by the air into the nasal passage to relieve congestion and inflammation of the respiratory tract. They are used, especially in the canines also. Sometimes they are used. And gas is an elastic aeriform fluid in which the molecules are separated from one another, able to move very freely. And gas is intended to be used directly by inhalation. So many gases are used as there, and these gases are known as therapeutic gases. Means the gases used for the treatment of a human being or the animal. So the therapeutic gas is the oxygen, carbon dioxide, and nitrous oxide. All these things are used very commonly. Oxygen administration is done in the hospital. At the same time, yesterday we have seen this thing. Yeah, this is the nitrous oxide, especially administered in the pregnant ladies for the ease of parturition, because whenever to avoid the epidural injection, because the epidural injection is a painful one, and sometimes it may damage the nerves also. There is chance of the paralysis. Hence, to avoid this thing, nitrous oxide gas is made to be inhaled by the ladies in the advanced parturition stage. So, inhalant, menthol inhalation is there. You can see that inhaler is used and inhaled by the person. And topical dosage form, DOSH, it's a irrigant, it's a sterile solution, drug of the drugs or rinsing of the body cavities, and mainly to wash out and treat infection of the vagina it is used. and dose. It's administered via thin, soft rubber tube known as the catheter. The term irrigant is also used for the sterile solution. Instead of dose, you can also use the term irrigant. Here, these are all the structures of those irrigants, and here in the rubber wall or rubber car, the medicine is kept, and later after squeezing the material will go through this catheter. And drops is liquid preparation in which drug solution or suspension is instilled into the body cavity, such as the ear, nose, mouth and eye drops. So the drops must be sterile and prepared under the same conditions and by same methods as parenteral preparation. Under a lot of sterile conditions, then without any bacteria or bacteria free and microorganisms free. So the varieties of the eye drops are also available, sulfosetamide eye drops, then the cotrimazole, this eye drops, cotrimazole IMAX, then carboxymethyl cellulose eye drops. These are all the eye drops. And sometimes the gentamicin and dexamethasone ophthalmic solutions, eye or ear drops. So these are all these things used. Enema is liquid preparation meant for administration into the rectum for the purpose of providing the drug for clearing out the bowel. Especially this is very commonly used in case of the buffalo cows which are affected with this roundworm infestation, especially in the young adult within 1 month of the age. It causes lot of what we call as the constipation in case of the cows, then enema is used. So usually the soap water enema is a very commonly used thing in case of the animals, just like this. And this is a in this one, the soap water is prepared maybe of any of the detergent soaps. Then it is put into the rectum of the animal and slowly released, so that the colon part of the animal is washed properly. Then this is a bag, enema bag, what we can say, and this is inserted into the rectum of the animal. Then the constipated animal would get cleared. And dentifrices are used with a toothbrush for the purpose of cleaning the accessible surface of the tooth. So there are also known as flosses, FLOSSES, and insufflations introduction. So these are introduced into the ear, nose or throat, administered by means of insufflator. This is an equipment which is used for the insufflation. Example, adrenaline insufflation, menthol insufflations. So then it's the liniment. It's not the liniment actually. Liniment, LINIMENT, is a liquid or semi-solid preparation of the drugs in oil, alcohol or soap intended for the external application on intact skin by inunction, means rubbing. So it has to be rubbed over the body wherever there is a pain or anything. The example of this one is the camphor liniment or liniment turpentine. Turpentine liniment is very commonly used in case of the cattle, and it's a rubefacient. So what is a rubefacient? It is a substance for topical application, and it produces redness of the skin. Whenever there is a redness of the skin, more and more blood will be flow to that area, and capillary dilatation will occur and increase in the blood circulation, so that the inflammation or the pain get reduced. So these are all the rubefacient, ready cream and other things. They are all the what you call as the creams containing these analgesic rubefacient. And lotion is a liquid preparation of the drug, usually in water, meant for the external application on skin without inaction, means without any rubbing. It is generally used for the local soothing, cooling, and or protective purpose. So the examples of these things are white lotion and calamine lotion. Whenever there is whenever if you go to a doctor with itching up of the skin, etc., there he is going to prescribe calamine lotion. Whenever there is a dermal allergy is there, at that time calamine lotion is applied in case of human being very commonly. Of course, this is also used in the case of dogs. And paint, here the paint means not the enamel paint or the paint used for coloring the wall. Here paint is liquid preparation of the drug in viscid solvent such as glycerin or liquid paraffin for application to skin or mucous membranes, usually with soft brush. So here the soft brush is taken and it is dipped in the particular medicine, then it is just like used as a painting. And throat paint is more viscous due to the high content of the glycerin, which is being sticky adheres to the affected site and prolongs the action of the drug. So you know, whenever you are suffering from the sore throat, it's a very tough situation because the microorganisms, they are going to cause a lot of irritation and what you call as the fever, etc. in you. So at that time, a paint made up of the Mandel's throat paint. Please remember, this is a very specific term, Mandel's throat paint containing the iodine. Here, this is a lotion and this is the throat paint, or this is also known as Mandel's paint. A small brush is taken and this is painted over the tonsil or the parts where there is erythema. And it is the, we are observing about the what you call as BPC. What is BPC? British Pharmaceutical Codex. According to that codex, it is prepared. And throat paint means betadine antiseptic paint. So they are painted, especially in government hospitals, whenever the patients do suffer from sore throat, and usually they are instructed to open their mouth and using a very smooth brush, they are going to and brush it. It's containing the glycerin and iodine. That's the Mandel's. Please remember, Mandel's paint is the one which is containing the iodine, glycerin. Shampoos, I think every one of you are using this. Shampoo is liquid soap or detergent used to clean the hair and scalp. Scalp means head and is often used as a vehicle for dermatological agents. Very commonly, it is used. So whenever there is a disorder like skin irritation, itching, dandruff and seborrhea, that's called as the red, itchy, rash and white scales. When it affects the scalp, it is called as the dandruff. You know what is a dandruff? Then it is shampoo is used. And in the shampoos, varieties of the shampoos are coming nowadays, especially in case of the pet practice, lot of shampoos are being used. The shampoos are do containing the hydrocortisone, especially in skin dermatitis, or sometimes the ketoconazole. Ketoconazole is an antifungal agent. Apart from this one, amitraz, then some of the anti-tick agents, they are all used in case of maybe cypermethrin or deltamethrin, and many other ingredients are used as the shampoo. And here you can see this is a hydrocortisone shampoo whenever there is a atopic dermatitis, especially in case of canines. It is used. Here OZ means ounce. Then it is also a cactopet, means it's containing ketoconazole, which is a very potent antifungal agent. And the solids and semisolids, in the solids we can use the creams as one of the important agents, and the semisolids are the one which are used for the emulsion preparation of the drugs, which usually contain more water, that's the 20% water, and less than 50% hydrocarbons, waxes, polyols as the vehicle. So this is used. There is a difference between the cream and paste, and it is intended for gentle rubbing over the skin or mucous membranes. Example is the, once again, calamine lotion is there, calamine cream is there. Whereas the lotion contains less than 20% of the water and more than 50% of the hydrocarbons, whereas the cream contains more than 20% water and volatile and less than 50% hydrocarbons, maybe the waxes or polyols, etc. as vehicles. And here this is a lactocalamine lotion. One is the lotion and another one is the cream. cream and lotion. And dusting powders is a preparation of the drugs in fine powder form for the application of the skin or mucous membranes by the process of dusting. And it may be applied for the protective and lubricant preparations properties on intact skin, or the adsorbent and antibacterial properties on the wounds. So especially the dusting powders are very commonly used after the surgery, because the skin sutures etc. Cannot be applied with the liquid drugs. So usually the solid drugs and powders, they make the tissue hard and wet. Then the medical dusting powder is the talcum powder and iodoform powder, whereas the surgical dusting powders, cornstarch and antimicrobial dusting powder. All these cornstarch is the agent which carries the drug. Here you can see that Johnson's baby powder is a talcum powder, and the iodoform, it is the dosage form of the surgical dusting powder. Iodoform powder is present. Means iodoform is present in lotion, paste and many other drug delivery system. And clotrimazole absorbent dusting powder is available, especially in case of the small kids. So this is absorbent dusting powders, especially antifungal powders. Usually the fungal infection occurs whenever there is wet what you call as the surface. Then because of this thing, what happens is the fungal infection occurs, especially the Dobie itch and Barber's itch. So these are all the fungal disease, and with this clotrimazole it's very commonly used. Electuary is a semi-solid preparation of the drugs mixed with the sugars and honey, intended for the application or smearing on the tongue, especially to make the drug very palatable. And palatable especially because some of the drugs cannot be taken orally, because they may be some what you call as having a bitter taste, sour taste. So because of this thing, its electuary is prepared and it's put on the tongue of the animal, and herbal electuary for the fever. Here you can see that the honey is used to prepare the drug dosage form. Just like this, this is some Ayurvedic ingredients are put on a plate, then the honey is mixed, then it becomes the herbal electuary. Insufflation, already we know it's a medical device used for putting the material into body cavities such as nose, throat, vagina, ears, etc., to which it would be difficult to apply the powder directly. And jelly is a transparent or translucent, non-greasy semi-solid preparation meant for external application to the skin or the mucous membranes, and it is generally prepared either or natural gums like the gum tragacanth, gum pectin and sodium alginates. So these are from synthetic derivatives. So here you can see this is a special device which is inserted in the ear to put the drug, and the tragacanth jelly is the one which is prepared from using the honey, etc. And here sodium alginate jelly, it's a very commonly, it's a sweet substance, and you are all going to eat this particular thing is concerned. And once again, the ointments, creams, pastes, gels, jellies, poultices, suppositories, they are the semi-solids very commonly used. Already ointment is a semi-solid preparation of the drugs, oily, fatty or paraffin bases meant for external application of the skin or mucous membranes. So already we know that this is containing 20% water and 50%. And the ointments of the examples are iodine ointment, sulfur ointment and Whitfield's ointment. Whitfield's ointment is a very effective ointment against the fungal infection where there is a keratin tissue is present. It contains the salicylic acid and benzoic acid in equal quantity, and it's a very good keratolytic agent, because this, whenever there is a fungal infection, lot of keratins are present, then it is used against those things. And paste is semi-solid, which contains large proportions, 20 to 25% of finely divided solids. Here more solids are there, in the fatty vehicle. It is generally very thick when compared to the ointment. It's more thick and suitable, providing suitable protective coating over the skin and mucous membranes. So the examples are bismuth, subnitrate, iodoform, paraffin paste, and zinc paste. So these are the examples. Whitfield's ointment, you have to remember this Whitfield's ointment because this is very commonly used in case of human beings and also in case of the animals as an antifungal agent, keratolytic agent, and povidone ointments. It is also very commonly used ointment. And bismuth, BSIP, that's bismuth subnitrate and iodoform paste. It's containing the bismuth subnitrate as the base. And patch is the medicated adhesive strip or the film that is applied to an external site to deliver the active ingredients into the outer surface of the body. So the belladonna patch, I think you have seen that belladonna patch. It's a material, sticky material, which comes in close contact with the skin and applied over the skin for the slow release of the drug to kill the pain, especially. Then the plaster, you know, this handy plast and other thing which are containing the medications and attaches to the dressing to offer protection and support and to furnish occlusion and macerating action and to bring the medication into the close contact with the skin. So this contains the zinc oxide adhesive plaster and lidocaine medicated plaster or lignocaine medicated plaster. So poultice or it's also known as cataplasm. It is semi-solid preparation consisting of soft heated mass of the meal, clay, plant part or other parts that spread on cloth and applied to skin to treat an aching, inflamed, painful part. So the poultice is such a substance that it's put in a particular cloth and it's heated to some extent and applied. So usually the onion poultice and linseed poultices are practiced in village conditions. Here you can see this is a belladonna patch or belladonna patch. So this is containing this porous type of the cloth which is containing the adhesive part. One is the adhesive part and another is the non-adhesive part. And transdermal patch is very commonly used medicated patch placed on the skin to deliver specific dose of the medication through skin. Especially there is intradermal absorption is there and scopolamine is commonly used as treatment for motion sickness. Yes, many of you might have got the motion sickness or your friends or relatives, they have got a motion sickness. What is a motion sickness? Whenever you are traveling in a bus, car or any other locomotor means, then there will be vomiting sensation. Whenever there is, it's also known as the motion sickness. So it is due to the imbalance of the body fluid, especially in the central nervous system. It is the motion sickness is originating from the disturbance in the brain, especially the vomiting center and higher centers in the brain. So so many tablets are also available, but for the slow absorption, the scopolamine is one of the important drug. Then it is used as a transdermal patch. Just like this, some of the animals are also put as the patches, especially the progesterone patch and also estrogen patch, etc. If the animal is not coming to estrus, estrogen patches are put on the body of the animal. And here you can see this adhesive tape. Many times it's very commonly used to put the bandage, especially plaster of Paris. You might have heard the calcium plaster of Paris, and lidocaine medicated plaster is also used, especially to kill the pain or temporary numbness of that particular part is made by using the lidocaine hydrochloride. And the poultice is here you can see that this is a onion containing cloth in which it is after this thing the onions are heated to some extent and it is applied on the body of especially these particular kids, and because of this thing the inflamed tissue etc become a little bit perforated on these, especially the more and more blood will flow to that area and it got reduced. And linseed poultice is just like the villagers are applying the poultices of this linseed meal and preparing and mixing it just like a mixture and applying on the body. That's the poultice. In village conditions, this is very commonly used. Suppository is a conical or ovoid solid preparation for insertion into body cavities other than mouth, where the solid inert base melts, dissolves, or softens at body temperature and releases active ingredient to exert local or less often systemic effect. The suppository is identified by different terms according to the body cavity for which they are used. Especially the examples are the rectal suppository, vaginal suppository, and sometimes they are also called as the pessaries or the pessaries, vaginal pessaries and rectal pessaries, and also nasal suppository and urethral suppository. These are all the examples of the suppository. And the example or practically available thing is glycerin rectal suppository and bisacodyl rectal suppository. Bisacodyl is a drug which makes the large intestine and also the colon to contract and it causes the purgation. So that's why it is used as a rectal suppository, and the glycerin rectal suppository is also used for the same purpose. And the gases, they are used as a spray is a liquid preparation of the drugs filled in container under pressure and is used as the aerosol and mist and pressing button. So the best example for the spray is your Volini spray, which is containing the menthol and also some diclofenac or any NSAIDs. And iperatromium nasal spray is the classical example. Here you can see this glycerin suppository. It's a cylindrical or conical shape which is inserted into the rectum. And the glycerin suppositories are like this. Glycerin content in 91 gram and sodium stearate. This is a excipient. Excipient is a substance which is inert in nature. And this is a bisacodyl suppository, 10 milligram. Dulcoflex, it's the trade name, and 10 milligram is one suppository every day. It should be put in the rectum, and at the same time, the purgation occurs within half an hour to 40 minutes. And iperatromium bromide is a very commonly used nasal spray. And the special type of the dosage forms are few. There are few. There are enteric coated tablets are there. Enteric coated tablet is a very special form of the oral tablet preparation that controls the location in digestive tract where the drug is released and absorbed. So many preparations, especially the preparations of this antacids like pantoprazole, omeprazole, etc., they are enteric coated because if they come in contact with that of the gastric hydrochloric acid, they are going to be destroyed. Hence, they are used as the enteric coated done over that particular tablets. The enteric coated tablet is designed by coating. And the materials used for enteric coating may include fatty acids, waxes, and shellac, which are all the inert materials. So these enteric coated tablets are used for the drugs which are discharged by gastric acid and also an irritant effect on the stomach. Aspirin is having irritant effect on the stomach, hence to bypass the stomach, it is coated with some of the inert material like fatty acids or waxes. It's also used for the drugs, those are intended to act on the intestine like anthelmintics and amebicides. So this is enteric coating tablets. Here you can see that outer coat is painted like by some waxes or inert substances. So this is also the enteric coated capsules are present here. Gelatin capsules is present. So this is not going to be dissolved in gastric HCl. and the drugs is going to release into the intestine or upper or downer part of the intestines. And chewable tablets are the one big sized tablets which are very difficult to swallow and consumed by biting or chewing in it. And most of the antacid tablets are chewable tablets like Digin, Gelusil and other thing that pills these tablets you might have seen. And layered tablets are the one which do contain many layers containing different drug formulations. And lozenge and sugar and gum and later giving strength and cohesiveness to the lozenge means to medicate the mouth and throat for cough remedies. This is Strepsils and Vicks lozenges you might have seen. So lozenges. The sugar coated tablets coated with sugar to disguise the taste. Then the sustained release capsule means sustained release capsule is a special type of the oral medication designed to release the drug gradually in the GI tract over an extended period of the time. And the finely powdered drug is first converted into pellets, then treated with protective coating of different thickness. And these granules are then mixed thoroughly and filled into capsules. When ingested, the granules of different batches dissolve and release drug at different times so that the constant quantity is maintained in the blood. Example is the ibuprofen. It's a non-steroidal anti-inflammatory agent. Indomethacin is also non-steroidal anti-inflammatory agents, and other stimulating agents like the dextroamphetamine, they are all used. This is a sustained release capsule. Both of these things, you can see that the drug is released very slowly. And this is a preparation, especially the aqueous solution. So sometimes it's used in 20 drops. Then alcoholic solution, it's 1 gram. Then solution mixture. So different type of the mixtures are available. Mixing and forming by composition. So here this such quantity is prepared to prepare the eye drops or nose drops. And usually it's a sterile isotonic pH solution and viscous solution, especially the nose drops. So this is how this is enteric coated tablets are working. Here enteric coated tablets, they are especially coming to the duodenum, then it is released in the lower part of the stomach, whereas the tablets and capsules, especially, they are dissolved in upper part of the intestine, duodenum, and the drops, mixture, or the effervescent solutions, usually they start absorption from the mouth itself and win the stomach, whereas the matric tablet is usually dissolved in stomach, and the enteric coated tablets with the delayed release, so they are not at all going to be dissolved in the upper part of the intestine. They go to the middle part of the intestine like this and they get dissolved. They are all the enteric coated tablets. And here you can see certain preparations are there. Multiple dose vial. This is a dose vial. This is an ampule. So this is a cartridge, especially this thing, and infusion solutions. Everything. And this is a paste. Paste is the one in which there is more solid contents are there. Ointment, little less these materials are there. And the powder, there is here in the powder, there are no moisture at all. And these are all the layers of the skin. And here you can see these, especially inhalants, nebulizers and other things, they are going to enter the, especially the lungs with different this molecular size like 100 micrometer, 10 micrometer and other things. So different parts of the this thing lungs are being absorbed by these drugs. So this is something about the solid liquid form of the dermatological solutions. There are aqueous solutions and alcoholic tinctures. Once again, powder, paste, oily paste, liniment, etc. So usually it is lipophilic cream is the cream in the water in oil, and hydrophilic cream is the oil in water. So the more quantity of oil is present and less quantity of the oil. And later they are applied on the skin, and it's absorbed into the different part of the skin, like lipophilic drug. Of course, more of the lipophilic drugs to absorb very properly and fastly, and subcutaneous fat also it is dissolved. And this is the route of the administration: injections, intranasal, intravenous. This is intravenous means inside the vein. Transdermal means the dermis